I did.
Yeah, we don't have quorum. Good morning, everybody.
Morning.
I would like to say good morning while we wait for quorum.
Do you have a full? No.
That's what we're waiting
Yeah,
for.
that's a shocker.
No, we'll wait for
Guy.
we'll wait for Mr. Quorum to show up.
This would have come in handy a couple days ago.
Yeah, there would have been chaos, more chaos than ever.
No, I need it.
So I guess I can't call it to order even. I will just say good morning.
Morning.
And I was waiting to see if Mr. Shepro was going to be here. This is what you call the long stall. I was waiting to see if Mr. Shepro would be here this morning to share with us a moment in history that today is the anniversary of, anybody know? The Gettysburg Address. Can you?
Yes, I was there.
There he is.
Mr. Quorum.
It's been 30 years and
Could the horse recite it back? Yeah.
Scored 7 years ago.
Mr. Quorum
Good morning.
Sorry I'm late.
here.
Yeah, sorry I'm late.
Now like to call to order the Public Health Committee for Wednesday, November 19th. And it is, I'm Cheryl Strathman, Chair. And here comes Mr. Shepro and Miss Bates. So we're going to have a full house this morning. So clerk, please call the roll.
Arroyo, Juby, Genesis,
Genesis,
Genesis.
are you here?
Sorry, Tarver,
Carver's here.
Young. He's online. Sanchez, Strathman,
Strathman here.
Roth.
Roth here.
Thank you, Mr. Roth.
You're welcome.
I would like to ask for remote approval for Mr. Tarver, Mr. Young, and Mr. Sanchez may be joining us. Any objections?
No problem.
And before we get started, I would like to say that this is public health, right? And all of you should know that this is a very important part of public health because today is World Toilet Day. Toilet Day, and think of what the sanitation improved with that. I mean, very important part of public health. I just thought I'd bring that up. So I would like to ask for approval of the minutes for October 22nd, 2025.
Genesis moves for a unanimous consent of the minutes on October 22nd, 2025.
Any objections?
No problem.
Okay, great. Thank you. And good morning, Mr. Shepro. Do you have anything you'd like to add to us this morning?
I do. Ken Shepro, county historian. November 19th, 1775 was the first clash of arms in South Carolina, the Revolution. Earlier, the royal governor had fled Charleston to a ship where he was trying to rally support. On November 19th, a colonial militia company went to the town of 96, which is still there. And I forgot to check why it's called 96, but there's some reason. It wasn't the population. And attacked the British in the fort. And he took the fort. Then the British came back and they actually made a deal that if the colonists agreed to surrender their arms, they could leave unmolested, which happened. And it was probably the last civil thing that took place in South Carolina. South Carolina was probably the site of the most vicious intra-colonial fight during the entire Revolutionary War. If you ever saw the movie The Patriot, where the loyalists burned the church with the people in it, and there are similar situations where the loyalists were the people that were slaughtered by their neighbors. And in the meantime, about 25 to 30,000 of the slaves in South Carolina managed to escape. Some joined the British Army, some went elsewhere, tried to go north, and South Carolina was a good example of it wasn't quite as just a clean Revolutionary War fight as we thought. So that is your semi-quincentennial moment for November 19th.
Mr.
Thank you.
Shepro. Yes, Mr. Roth.
Since Mr. Arroyo is here, I can step down as quorum because he fulfills your quorum requirement.
Okay, thank you, Mr. Roth.
Mr. Royal forgot his glasses, so he may not be that useful, so. Yeah, I'm looking for them right
Okay.
now. I think I'm-
Welcome, Mr. Arroyo. Okay, so we have no public speakers today. Okay. And oh,
Thank you, Mr. Juby.
okay, come on up.
Thank you.
It was up there, but we grabbed it too soon. So come on up and just state your name and town.
Thank you for the privilege of speaking. Denise Theobald, Geneva. I'd like to address some comments that were made at the last board member by Mr. Young. You said that ICE was just doing their job. That couldn't be farthest from the truth. I do encourage you to watch many of our neighboring town hall meetings, including the St. Charles meeting from Monday night, where roughly 15 residents shared heartbreaking accounts of what's happening in our backyard. You'll hear over and over again that ICE is not lawfully doing its job nor its constitutional duties by denying due process, racial profiling, detaining residents with undue force and without judicial warrants. If these individuals were actual criminals, why not show a judicial warrant? You also question who would enforce the resolution. Kane County has no obligation to allow use of its property or facilities to federal agencies. This is called non-commandeering county property. It does not mean physically obstructing ICE. I suggest, Mr. Young, if you're listening, to listen again to State's Attorney Moser's explanation of the law at the last meeting. You further claim that all undocumented immigrants are criminals. Again, only 6.2% of those detained in Operation Midway Blitz had a criminal past. Immigration violations are civil matters, not criminal offenses. The Constitution protects all persons. The Fifth Amendment guarantees that no person shall be deprived of life, liberty, property without due process. The 14th Amendment guarantees equal protection under the law. The Constitution is the supreme law of the land, superseding any statutes you might cite out of context. The word illegal appears nowhere in the Constitution. And to be clear, no person is illegal. This terminology is incorrect, dehumanizing, sorry about that, and dangerous. Residents are afraid to go to work, report abuse, report disease, get the food they need. Kids aren't going to school. Mental health crisis is rampant. This is a public health emergency. And finally, I must address your conduct. Your brushing off of the deep concerns of constituents, your disrespect aimed at fellow board members, your aggressive tone and outbursts at the last meeting was not only embarrassing, but shocking. In any other organization, this would not be tolerated and have consequences. Your attitude over time on this board has demonstrated only one thing, Mr. Young, and that you're obviously not in a position to actually serve. For the good of Kane County, we ask you to resign. Thank you.
Thank you. And that concludes our public speaking. And the reports are on file. Any questions about the reports? Okay. So we will turn it over to Mr. Youngstead. Good morning.
Good morning, everyone. All of my reports are on file. If you have questions over any of my numbers, I always ask that you please let me know. I'm excited to get into my resolution today, so I hope we can go to that if everybody's okay.
Okay. So the resolution, I'd like to have a motion and a second to accept the resolution with the temporary number of 25-1415. And it is the acceptance and use of trust donation made to animal control. Can I have a motion and a second?
Hennessis will move.
Genesis? Juby, thank you. You want to tell us about this?
Yes, we are very excited. For the second year in a row, we've been blessed to receive a $10,000 trust donation. And Mr. Gripe, you brought up something when we laid out the plans for the dog jog about having a roof. And it is something that has stuck with me, and I've been trying to figure out how to get this done. This has been our ticket to get that done. So we've already been in contact with the person who installed everything. We're looking at options now. We think a covered area to protect from the sun, the rain, the weather elements, period, is going to be an amazing addition here. This is going to be such a peaceful serenity. Let me back up 1 second. Energy and Environment has been gracious enough to make a donation of native plants to our facility. We want to, so we've already met with them once. We're going to meet with another company in the next couple of weeks. This wouldn't be something that comes until the spring, similar to the butterfly garden that's outside this building. We want to do something like that also as well in front of, we currently have these weedy bushes. We would like to eliminate those. They're more of a nuisance than anything, and put in this beautiful garden with the help of Energy and Environment. This area is going to become a serene garden, hopefully, to allow animals to get out of the facility, to get into nature, to sit with a volunteer. It's going to allow the community a place to have that same exact thing where they can go on this beautiful walk on the Geneva Trail, come back to our facility, relax. There's a doggy way station. Sorry, I think that's the appropriate way to say it. A water fountain, benches for them to sit. Now you're covered from the elements, and you get to see hopefully a butterfly garden where we can get some butterflies. Again, creating this serene area for people to really escape here in Kane County and with their pets. And that's what we're trying to encourage. So we're very excited that we were blessed with this $10,000 donation. And with your approval, that is what we're hoping to do, is put a cover over this area to make it even more useful at more times to people.
Okay. Any comments or questions? Ms. Juby?
Well, I think that's a great idea. And I probably should have asked this question when we were talking about actually doing the water fountain, and I'm sorry. So can I ask a question about the water fountain?
Sure.
Okay. I'm not really sure. Is there standing water in the water fountain? Because I know that there's a couple diseases that can be passed from pet to pet with communal water. That's not going to happen here, right? We
No,
don't have-
actually, I actually discussed this with our builder. There's a reason we went with this company. It actually drains. What it does is it's a slow fill. So as you fill it, it's going to fill and hold, but it will slowly, fully drain out of the bowl. I'm also OCD and have been out there cleaning it at least once a week. So we make sure that it gets scrubbed down, and we use our accelerated hydrogen peroxide. So it's killing organic material inside of there. No, we're very cautious because we're worried about the same exact thing you are. We also don't want any larva issues with any more mosquitoes throughout this neighborhood. So we don't want any standing water as much as possible. So no, we've made sure it goes underground and is disposed of appropriately.
Okay. So we don't have to worry about like possums and raccoons and.
Unless they can somehow reach up and hit the button, they might get their
Well,
friends.
let me tell you, they can, because
Oh, I
they
don't
are,
doubt it.
you know,
Like,
they have opposable thumbs, and it's everything's the bite, but okay. So, but you do. take
yes,
measures. Okay.
we did think that through. I was worried about the same thing, just like having any animal poops on that area. The reason we put a water spout that's actually locked up, we have it on there so we have a 6-foot hose. We can connect right to it and hose everything down. We don't want feces sitting there either.
Animals can learn. I have to tell you that my dogger, who lives in the city, has learned to use the elevator in his building. By himself.
I think doorknobs are still our last holding, our last protection.
Yeah.
Oh, I was worried about that.
Yeah, he goes down to the lobby by himself and yeah. So they can
Mr.
learn.
Ro-
Yes, Mr.
Do we have a trail camera on the,
Do we have a what? I'm sorry.
a trail camera? So we can
facility-
capture the raccoons learning how to turn the water on.
Cameras at one of our outdoor cameras at our front lobby. We position this to ensure that that is on camera should there be an incident or everything. So it is being monitored at all times.
Good.
Yes.
Okay, great. Any other questions or comments? Okay, please call the roll.
Arroyo,
Oh, yes.
Doobie,
GBI.
Genesis,
Genesis, yes.
Carver,
Tarver, yes.
Young. Mr. Young,
Sorry, trying to unmute myself. Yes.
thank you. Strathman,
Strathman, yes. And that will go to Finance
Yep.
Committee from here.
Yes.
So thank you.
Thank you, everyone.
Okay, yay. Anything else that you wanted?
That's all I had today, but I'm here for questions, concerns, please.
Okay, great. Great. Okay, so then we will move along to Mr. Michael Isaacson.
Good morning, everyone. First, I want to thank you for the great discussion last month about how we use data. I'm excited when we get to new business to talk about what our committee goals are, and thank you to Ms. Juby for sending some draft goals. A couple things I want to highlight this morning. Number one, we continue to monitor what's happening both with funding and policy, and I'll occasionally get questions from people to say, well, what's the impact in terms of numbers? But as people are watching the news, it is a little bit challenging because everything is constantly shifting because we see different proposals come out from funding at the federal level, which we don't get a lot of direct funding from the federal government, but a fair amount of our funding that comes from the state of Illinois does pass down from the federal government to the state government. So we're continuing to watch that. And then there's constant policy changes that are shifting and changes in contract language that we're continuing to evaluate that may impact how we're able to provide services, sometimes a detriment to the services that we're trying to provide. So I will keep you informed as those things become more solid, but there's just a lot going on in that realm right now that we're trying to keep tabs on. Something more positive, we are excited. Last week, we moved our staff out of our previous Elgin building. So we'll be able to end that lease and save money on that. So we have what we're calling kind of our stage 0 right now, where we have folks that are in the new building. We haven't done all the renovation yet, but we have folks that are in there so it can be operational. So that they're unpacking boxes and settling in now. So I'm very appreciative of all the folks who've moved because that's stressful to move. Where is everything and where did that box go? All that fun kind of stuff. And then thankful for IT and building management and anybody who's been helping us with that move. We're really excited because this is a building that we own. We're able to have hopefully much better IT hookups. We were renting previously, and so we had years and years of issues with just using a commercial internet connection, which was slow and dropped, and people had a lot of problems. So just that alone, I think, is going to make things a lot more efficient. So we will share more about having more of a show and tell next month. And I don't know if we're saying that or if it's not official yet. So
I think we should give us a statement about it this morning. even
Okay.
though it may not be totally.
Okay.
official yet, So,
So we're talking about potentially hosting our public health committee meeting in December up at the Elgin facility, just so people can get a look at it. So again, this is pre-construction. The clerk's office, I think, is shaping up. We're looking at shared space where, again, it's my job to always point out that we used health department funds to purchase this building. But we're looking to co-locate with the clerk's office and eventually bring court services. I think the coroner is going to have an office. So I think for the county as a whole, this is going to be just a really nice resource for the northern part of the county. So stay tuned for more details about next month. And then in 2026, it's really going to be amazing when we have a better meeting space up north where we can have large trainings and things like that for the county. And then echoing some of the speakers' comments, we do continue to see a negative psychological impact on folks in our community. Obviously, it's all over the news with immigration raids. And I'm not talking about federal immigration policy. That's not my role. But this is detrimental to the residents that we have in our community. I personally know multiple people who have been deported or families who have been impacted by people. And I think it's important, even as we are looking at, okay, enforcing civil law, the dramatic impact that this has on our families. And for young people who lose a parent to deportation, when we work with grief counselors, they talk about that as being the same as the parent dying, because the parent is there one day and they're gone the next. And this is something, we live in a very diverse community. So this is something that we've had for years in Kane County, where people are deported sometimes. But the way it's happening now and how aggressive it is to families, and even prior to this large scale campaign that's been going on in the Chicagoland area, at our last Youth Voices Forum, this type of the way kids would interact with each other in school, this came up as one of the top issues for young people, because we were seeing a lot of, I'm going to call ICE on you, I'm going to tell on your family. And I want to be really clear that this is being done, at least the way it's reported to us, in more of a racist way, that it doesn't necessarily mean that somebody has an undocumented family, which I would say that's not appropriate for people to say to each other either, but it's just being used against anybody who is of color. And this can be people from the Middle East. It can be somebody who looks like they may be Hispanic. So this is what the young people are telling us that they're hearing that is negatively impacting their mental health. So again, I'm not saying how laws should or shouldn't be enforced, or what our policy should be, but there is a negative impact that we're hearing and we're seeing in our community. So just from a public health perspective, I did want to point that out. So we do have a full report from our Youth Voices Forum that we've shared. I can share another copy if people would like to see that. And again, this is the voice of young people saying what's impacting them. So with that, I'll transition, and we, as part of our program focus today, we want to focus on giving updates on some of the behavioral health work that's been going on. So I will turn it over to Director Peterson and her team. Switch on the side.
Okay, can you hear me? All right. Well, hello, everyone. I'm Kim Peterson, Director for Community Health at the Kane County Health Department. And I've been working at the health department for about 6.5 years in progressive roles. So you've probably seen me around. But today I'm here to do an update on our county behavioral health supports and initiatives. It's going to be a little interactive in the beginning. So if you can go in your little blue bag and pull out the pamphlet that says Behavioral Health 360, and it has a little QR code on it.
You're off.
I think okay, there we go. If you want to scan that QR code, that would be great on your phone, or I'm about to give you the website link too, if you can follow along on your laptop just in the beginning. Yes, it is. Yep. Yes. So today I'm just going to briefly, I'm going to try to keep it brief, but I get so excited and we have so many great things going on. Hopefully someone could give me a warning when I've gone too long. So we're going to talk about our self-help program that we've launched, which is Behavioral Health 360, give a little update on that. And also talk about our program, the Information and Referral Specialist program, and the outcomes of our neuropsychological evals that we funded. Talk a little bit about our Mind Matters monthly training series and our mental health first aid trainings that'll be launching very soon. So here's the URL for those of you on a laptop. If you couldn't scan the QR code, you can go to https://kanehealth.crediblemmind.com and follow along that way. So if you're feeling a little off, the reason I put this is, there's different levels of behavioral health care. There's different levels of mental health. And we always talk about prevention. And, when you're starting to feel a little off, but you're kind of like, okay, this is fine. I can still, I can still really function and I'm just feeling a little down. Maybe things aren't exciting. What was that? Oh, all right. So we talk about this level of intervention, which is kind of like, let me see if there's anything that I can do to learn more about how I'm feeling or the situation I'm in and gain reasonable tools to kind of help me out of this slump, basically. And that is our Behavioral Health 360 site. And it's a free and confidential website to help individuals manage their well-being with behavioral health topics, self-assessments, evidence-based guides and tools, wellness tips and articles, and Kane County resources. We analyze the data for this every single month on the back end, and there's a lot of stats I can share with you, but I think the most important are that overwhelmingly our community, the most visited topics are anxiety, depression, and suicide and prevention month after month. So these are the things people are searching, and falls in line with kind of like all the anecdotal data we get from talking to community members as well as other providers in the space. And you can see our user stats. And when we launched in February, we did a big push and had a lot of demos. And obviously we were up to about 2,000 users per month. And then it kind of dipped down. And I think in the summer months too, people are a little happier because and doing things and not as on their, hopefully not on their devices as much. But now you're seeing that in October, we had another huge spike and are back to the numbers of engagement that we were, higher than at launch, which is big. And again, we want people to be engaging with this site, but it also tells you that people are struggling. And they are enjoying the website. And when we look at our numbers of how long people kind of stay on the website, it's a lot longer than other communities as well, about 11 minutes. And actually that might sound not a lot, but when you look at website analytics, that's a long time to be spending on a new website. I just kind of wanted to show you, Courtney did a great demo. Courtney Duran is our clinical manager for behavioral health, and she's in charge of this project. And she did a great demo for you guys a couple months ago, but I wanted to dive into a specific topic, holiday stress, and kind of show you when you search a topic, what it might look like and all the different resources you could take advantage of. So a lot of people report the holidays stress them out for different reasons. Obviously, you have financial worries. A lot of people have lost their jobs lately. There's also that pressure to, if you have children or just buying gifts for anyone. There's also disrupted sleep patterns, disrupted eating patterns, and also dealing with families. If your family isn't always, if it's a source of stress for you, that can be a worry. So I put in holiday stress, and you can see there's one assessment. Are the holidays causing you stress? And maybe you would know that, but it's good to kind of say, is it really stress, or am I just like excited, or, can I manage this? And then also there's articles that come up. So as you can see, the topics, 7 ways to melt holiday stress and cozy up for a better night's sleep, so there's some more lighthearted ones. And then there's things like why the holidays are hard for people in recovery, because, everyone's drinking or things like that. And if you're in recovery, that can be hard. So any type of, and then the loneliness issue as well. So any type of issue you might be having around this, there are articles, and these are all evidence-based and vetted by clinicians and researchers. In addition, still on the topic of holiday stress, and again, you can search that while we're talking, or there's many, you can search pretty much anything. But there's also news and podcasts. So if you prefer to get your information audio, Audible style, or in a news format, you can also find resources there. So you coping with grief during the holidays, for example, is a podcast episode. The Being Well Holiday Survival Guide there, and is another podcast just to talk to you about the different tools and tips you can use to be less stressed during this time. And then there's also videos. Some people are more visual learners or like those little snippets. And these videos are 1 to 5 minutes. They're nothing long. Again, just real people giving real tips about these things can really help people. And then it also offers insights and practical advice. I love this article, Practices to Overcome Financial Stress and Find Joy During the Holidays. Again, if you're feeling that financial pressure, it really does give tips about how to kind of budget for the holidays and minimize the gifts if you're and communicate with others about why the holidays might look a little bit different this year if you're experiencing financial stress. And then there's also apps. And I love this feature as well because there's so many different apps. When you pull up holiday stress, of course, the overeating part comes in too, because then you don't feel well and then there you feel bad about yourself. There's a whole cycle. So there's a lot of fitness apps and just tracking calories, tracking your different vitamins and your macros, if anyone's into that. Also just incorporating different levels of workouts. So there's links to all these different apps that you can choose whichever one might work for you and download that and use it on a regular basis to keep yourself on track. And there's also apps for financial planning. There's apps for sleep. There are apps for meditation. So there's a lot of different resources at your fingertips. And then I also search by topic grief, because again, this is the big one that comes up around the holidays. If you've lost someone during this time, or it's your first Christmas or your first holiday without a person that you love, it can be really hard. So not only will it come up with the Kane County resources, you see our partners at Fox Valley Hands of Hope there, you know, one of our biggest referral partners, but a lot of other referral partners that are actual brick and mortar or you know, face-to-face services that people can engage with if they need a little bit more than just kind of their self-learning and self-exploration. And then the crisis resources are always there. There's a button up top that says Get Help Now. And this is just a screenshot of a few of them just for the crisis lifelines. There's even one, as you see on the bottom, for just veterans. We recently added one for the Farmers Crisis Hotline, which we didn't know existed, but it does. And that is a great one as well. So again, this is just one topic that you can explore. There's many different topics, and it's not just when you're in a crisis, it's kind of anything that you want to improve in your life. So if you're in that place where you can manage everything and you learn about yourself and then you implement those tactics and then you're feeling better and more productive, you're good. If you're still feeling like you need more supportive help or someone you love needs more supportive help, or you're not even sure what resources are available to King County residents, the next level of support we offer is a program which is called our Information and Referral Specialist. And her name is Tony Garcia. She works under Courtney, and this is what she does. She connects residents to community agencies, and she provides guidance and support to navigate available resources such as substance use, mental health, food, financial assistance, and more. And so she does an assessment with folks when they call, or they can submit a form online, and she'll do tailored referrals based on those assessments and talking to the person about, well, if you're struggling with this, are you also in need of this? And then what can we do to help you? And then she does make those direct referrals on their behalf and keeps in touch with them until they feel like they're fully connected with what they need. This program we created from the ARPA funds. And so we have Courtney's position, Tony's position, and then we do have behavioral health interns on a rotating basis that really help the residents as well. So they kind of model what Tony's doing and help her out there. And this also helps build the pipeline of behavioral health providers in our community. As we know, there's a very big shortage for many different reasons in these fields. There's a high burnout, low pay, different things like that. So we want to continue to assist building that pipeline of folks to educate and help train to work in this field, in the helping field. And so they help out with this program as well. As far as our first year data, so this data is representative of October 2024 to October 2025. So just 1 year. A total of 676 clients served. And as you can see, most of them were from Aurora or Elgin, and 93.5% of them were seeking between 1 and 3 services. 3 and 5 have public insurance, and the majority are 0 to 17 years old. So that would be the parent or guardian calling on their behalf. But as you can see, kind of the breakdown of who we've served and which quarter had the most inquiries. And I do want to note, and we'll talk about this in a second, that Q1 of 2025 had a huge spike because we did have our neuropsych eval program going on at that time. And that is a huge need in our community that we were able to fill. And then that last month, it looks low, but that's only 1 month of the quarter, just so you know. So that'll be at least ×3, that number. In the top 5 most requested services, of course, we had the special project of the neuropsych evals, and that was the most common inquiry, and that will be a lot different by next year because we won't have that one. But counseling and therapy, psychiatry and med management, then medical. So, you know, we hook people up with FQHCs, primary care, different needs that they have around that, and then housing and shelter. Clients served by age group. As you can see, we have a good variety until we get to the 65 and up. And we know there's a lot of needs out there. So we want everyone's help to let seniors know that we're here for them as well. If you're talking to people, we have these brochures that you guys can give out to different groups you go to or your constituents, and let folks know that if they're trying to navigate care, we have organizations that can help find senior care, find in-home care, find assisted living, those kinds of things. So please spread the word, and we would like to engage more seniors, but overall we have a good diversity in age. Same with gender. We were kind of surprised by this, but it's almost 50-50, which females are more likely to seek help when they need it. So usually you see a huge disparity there, but we're seeing pretty equal numbers, which is great. Insurance type, this was our mission, to serve those that are underinsured or uninsured. And so most of them were on public insurance or Medicaid. So that was our goal. And, you know, we're really filling that need and that gap there. And as you can see, the breakdown of the top 5 locations, we had representation. We serve clients from almost every place in Kane County, but these are the top 5, as you can see. And it's mainly, it looks somewhat population based, obviously, but it was really exciting to see that there were also folks from Geneva, Batavia, everywhere throughout the county. And then these are just the outcomes. 78% of those referrals sent were completed, meaning that the client was able to connect with those services and either enroll or get what they need through that call. The 22% we either didn't know or they were unable to connect. So it's mostly that we didn't know what the outcome of that, because we lost them to follow up or something. But that's still pretty good for the population that we work with. And we're always striving to increase those outcomes. The neuropsych evals, I'm just going to quickly talk about this, is, you know, folks are in need of these evaluations. If your child or you need accommodations at school or work or need services outside of school, like additional speech therapy or physical therapy, you cannot get those services unless you have a medical diagnosis by a qualified provider. And most time those evaluations are anywhere from $3,000 to $6,000 out of pocket. And they usually don't even take private insurance, but they definitely don't take Medicaid. So we saw the need, and we funded these 2 organizations to provide those services to the families that had been waiting for this kind of opportunity to come up and could never access these before. 91% of these folks were on Medicaid or public insurance, and we vetted them all income and family size to make sure it was those folks that really would never have access to this without this program. And you can see the diagnoses that were given. And again, it's not fully done. They have until the end of next year to complete all of these. But so far, it looks like the main diagnoses that are coming up are ADHD, followed by depression. So it's not only ADHD, autism, it's also some of those big mental health disorders that can appear and have the same symptoms as the other types of neurological issues like ADHD and autism spectrum disorder. But I think it's just interesting to see the different type of diagnoses that have come out of this project. Switching gears to our provider programs. This is our Mind Matters monthly training series. You guys might join, maybe you join on a Friday sometimes. Our main goal was to provide continuing education units for those who have licenses in this area. So LPC, LCPC, LSW, all of those, so licensed social workers and licensed counselors, they have to keep up their licenses with these continuing ed credits. And we offer these trainings for free. They're usually once a month, Friday, for about 2 hours. From just January 25 to October 2025, there were 1,179 attendees. So these are Kane County providers attending these. Typically, we have about 200 folks register for each, about 100 show up, which is kind of normal, and they are virtual. And Courtney does a great job vetting the trainers based on feedback from the participants of what they want next. April was our autism spectrum services special training, and that was the most popular by far. And you can see that here too. This is a little busy here, but the blue is strongly agree and the orange is agree. So most agree that they were satisfied with all of the trainings. Again, the Autism Spectrum 101 seems to be the biggest area of interest, which again tracks with kind of our other project related to the neuropsych evals. And then finally, our mental health first aid trainings. This training is a great one for people, anyone really, from the front desk person at an organization all the way to the highest staff. Everyone has mental health. People go through things and people behave in, different ways in different situations, and to know how to handle when someone's having a crisis or even just a behavior pattern over time is huge in our community. And so Courtney and Tony have been trained to be instructors, and they are starting with senior services and the MRC volunteers in the next month, training those staff. If there are other organizations we want to try to stay with the ones that are very underfunded that probably couldn't pay for this for themselves. We will come in and we won't charge anything, and they will train them on this model. And it can be businesses, it can be anything like that. Just anyone who wants to know how to really act and help in situations where there is a mental health crisis going on. So we're starting this project, and we will really amp it up in 2026 as well. So that's our update. We've been doing a lot and we're super busy, but we're very thankful for everything we've been able to do. And I think the community is responding positively. Any questions?
Okay, Mr. Genesis.
Great presentation.
Thank you.
Mathers and Plumtree, are they located in Kane County?
Yes. So Mathers has a location in Elgin and St. Charles, and then Plumtree's in St. Charles. What we did, we had to do the RFP process where we put a bid out saying we need organizations to apply to do these neuropsych evals. Here's the amount of money we're going to be giving. And we scored all the proposals. Those two had the best proposals for the finances given. And also they were centrally located. So
Right.
since we have both ends, it ended up really, really good. And I think we've all had a positive experience working together, and the families have given really good feedback back as well.
Oh, that's great that we got great locations.
Yeah.
The diagnoses, that more than one, obviously, for some of these people, like
Yes.
ADHD and depression,
Co-occurring.
top two.
Mhm.
So you have, what is the number of diagnoses that a person receives usually when you get these diagnoses?
I mean, I'm not sure about that. And we will have more in-depth data at the end of this when everyone's done with their evaluations, but some of them have received multiple diagnoses. It doesn't look like there's too much overlap based on the numbers.
Okay.
But I would have to dive deeper to answer that question. And I think a lot of people they might experience depression because, like, if you have ADHD and you're having trouble learning, and then you do bad in school,
Or dyslexia, or one of the others,
anything,
absolutely.
anything like that. So
Right.
yeah.
Thank you.
Yes, Ms. Bates.
Is the evaluation only offered to people who live in Kane County?
Yes.
I have two friends from Kendall who,
I know. We had so many calls. We have a huge waiting list still. We ran out of funding, obviously,
okay,
but we have a huge waiting list still if we ever get the opportunity to fund something like this again. And then we were getting calls from DuPage. I mean, people were desperate. And so this just shows this is a huge need and people have been waiting forever and they really can't get their therapies without this.
that's terrible. Did you say that was only a one time? Will we be doing it again next year?
I hope so, but this was part of the ARPA funding. So I'm diligently looking at other funding opportunities for something like this. And if you guys hear of anything, please let me know because it's still a very large need in our community. And, we did a really good job partnering in like advertising it and making sure the right people were connected and that we were serving those people that really could not afford it.
Yes, Ms. Juby.
So going back to the training that you offered, how long does that training, is that like an 8-hour training, a 6-hour training, a 4-hour training?
Mental health first aid?
Yeah.
To the microphone so everybody can hear you.
Should I say my name? Sure. Hi, I'm Courtney. So we do the blended version of this just to save people time, because if we were to do the in-person, it would be 7 hours, like a full day of training. So we do 2 hours of pre-work, self-paced, and then about 4 to 5 hours of in-person instructor-led portion.
Okay, I was just thinking that it might be something that the county board could benefit from, so.
Yeah.
But I don't know if we want to give up 5 hours. Oh, that's right. We give up 5 hours all the time.
And Mr. Young, I see you have your hand raised.
Yeah, thank you. David Young. Was this in our packet? I quickly scrolled through it. I knew I was going to be remote, but was this presentation in our packet?
It is not in our packet.
Going forward, I know that this has happened several times. Going forward, I would like to have the public health department put these in our packet so we can actually review them and even go back to them. So I know that this has been a request I've had in the past, so hopefully going forward, any future presentations, they'll be part of the packet so we can actually take a look at it, even be prepared to answer or ask questions when we meet. Thank you.
Thank you for that good suggestion, and we will try to do that because it's a lot of good information. So, Mr. Gripe.
Thank you, Madam Chair. Yeah, very interesting stuff. I wouldn't want to use the word good with it because there's a lot of concerning stuff. But if I heard you correctly, I think you said the neuropsych evaluations were going away. And so I kind of have a two-pronged follow-up to that. If I did hear that correctly, based on some comments you were making, Michael, about, what's going on and people are upset about not just ICE and other stuff, but lots of stuff. But especially that, what I think we don't do a good job of helping people with, and I'm not pointing this at the health department, it's just we, the everybody.
The royal we.
Yeah, the royal we. No, not the royal we. Everybody in King County, everybody in the world, helping people through stuff like this. So in schools, and I mentor a fourth grader, and I listen to the kids, what they're talking about. So if people are saying things that they shouldn't, how do we help them through that? That you don't need to be afraid of this, and here's how you're okay, and here's what you should do if you hear something, instead of, I think we feed the fire sometimes too much. And, it's called tribalism, where we say this group should hate this group and this group should hate this group and so on and so on and so on and so on. That can really mess with your psyche. So I'd love to see clearly you're doing things for it. You've talked about it here, but how we could expand that to say, just, be kind, be considerate, don't speak out against other people, just keep it to yourself and let's move on. I think that would go a long way towards helping Kane County neighbors live with other Kane County neighbors, even though there's differences. So that's a very wide request. So you guys are on it. You're dealing with it. I really appreciate that. But anything we can do to get at specific issues and try and just get people to relax and tone down so we can try and understand each other would be great. By
So I
tomorrow,
think
maybe?
we do have a communications campaign going on too, and part of this is also breaking the stigma. A lot of people act out in those ways when they're feeling internal rage or grief. So going to therapy and having some self-awareness about your own behavior and your own reactions to things is huge in this way, and also trauma-informed practices. And we do a lot of trauma-informed presentations too. But yes, the message is always, kindness first. It's just when people are at the end of their rope or dealing with a lot of things, that's when that breaks down. So having those referral services to counseling, because counseling really does help decrease that rage and decrease the likelihood that people will externalize that rage instead of dealing with it.
If I can, quick clarification, is there group things available? And I don't mean like group therapy, but just like communications, because one-on-one is awesome.
Yeah.
But there's 500,000 people in Kane County. So how can we help, and how can we help communicating to our constituents, here are resources, here's a group thing you could do, here's some whatever. I'd love to know how we can help our people.
We do have a community calendar also that our health promotions manager manages on our website, and all of our partners can go on and put their different initiatives up there and what dates. So they often have, like Tri-City Family Services often has a lot of groups. There's groups for children on the spectrum. There's groups for parents. There's groups to increase diversity, interactions between diverse populations. There are groups for coping with loss. There's a lot of different things. And so I encourage folks to go into that resources page, as well as give us a call at our information and referral specialists. We're always aware of those types of group opportunities.
Okay, Mr. Tarver, your hand has been raised a long time. I apologize.
Thank you, Madam Chair. Just a couple of things. Kim, wonderful program that you have going. I want to share with my colleague, Ms. Juby. I've attended that program, the mental health first aid training, and I highly recommend it for anybody. Certainly has come in use in the job that I do. A couple questions. If I saw the number correctly, between October of last year and this year, that number's in the 600s. Where do you see that number going? Do you see that kind of staying where you have budgeted towards, or do you see that number increasing in the years to come?
That's a great question.
Well, because I have a follow-up. That's the reason I want to ask that first question.
Yeah, I mean, we're seeing it definitely. We saw that spike with the neuropsych eval, so we have to wait till it kind of evens out. It looks like we'll be evening out at about 200 folks a quarter. But during the holidays, we do usually see an increase, and then again through the winter. And then the fall, the summer is usually a dip. So I would say it would stay pretty static or increase over time, depending on, again, I don't want to bring this up again, but things that are going on in society and how much stress people are feeling, whether it be the economic things that are going on or the, other types of things.
Yeah,
And
thank you.
Mr.
And I see a
Tarver?
lot, majority are the people that are in our school system as well. And obviously we see a trend in a lot of these scenarios, first and second quarter, which is what you're describing. And then my second part is, I'm assuming that yourself or maybe Michael have seen the new crisis center crisis recovery center that DuPage just opened up. And I'm wondering, as this program develops, is that something that's on the vision for long-term, for my colleagues who might not be aware of that? Just wondering if that is something that the health department might be moving towards in the future.
That would be amazing. It certainly is a need in Kane County for something like that. So I think we've talked about this in the past. But DuPage County used federal dollars to build a building where they are doing a crisis stabilization unit. So rather than taking people to jail or to the emergency room where we're less equipped to deal with these things, we can kind of have a step down where people can go in, they can get the care they need. They actually are providing detox services. So this is something that's tremendous. And I'm very envious of our colleagues in DuPage County that they have this because it's a great resource for residents there.
And if there's
Dream- It's a dream, but I think we are a long ways from there in terms of stable, consistent funding for mental health. So DuPage County probably has as much mental health funding as we have funding for all of public health on an annual basis. So I think we're moving in that direction, but I don't want to set any false expectations that that's on the near horizon. We're a ways from that yet.
No, and I understand. I appreciate the honesty too. I just want to work towards that as long as you do as well. So if there's things that the board can do to help see that in a 5 or 10 year plan, I definitely feel like that is definitely beneficial. I've seen it work within our school system. Go in there, like you said, students and families can go there instead of going to the ER room for any type of diagnosis or even step down services. And it takes the pressure off of our hospitals. So I appreciate that, and keep up the good work, everybody. Thank you.
Thank you.
Mr. Young, I see you have your hand raised again.
I do. Thank you. David Young. I wanted to comment on what John Gripe said, which was what Michael had said about deportations and ICE. And I'd like to, since Michael is dealing with this, he should think of a message that is soft, but yet firm at the same time. It says basically U.S. citizens are not being deported. People that are here illegally could be. And I know that's probably not the right way to say it, but it's the truthful way of saying it at the same time. So it is heartbreaking that if someone does have to leave and they have to leave a family behind, but I think the person that's coming to the health department and talking to Michael should also understand that there are certain rules that need to be followed. And if they're not followed, there are, unfortunately, there's going to be repercussions. So how you go about doing that, I don't know, but I just wanted to follow on what John said. Thank you.
Was first.
Oh, thank you. I'm sorry, Ms.
Oh,
Bates.
can I just say one thing about that too? World Relief has a great presentation that we share with all of our collaborative meetings about the different laws and the different rights that, different levels of citizenship have in different types of situations and what to do in the situations and what to carry with you. So if anyone is interested, and they do a lot of that messaging. So I'm just putting that out there that they have a great information on every single thing that you could think of regarding that.
Thank you.
Space. Going back to the first aid program, I spent most of a day here learning CPR.
Yes.
And that was a class that was offered, I think, just to board members. I would appreciate a class on if we could get a session of the first aid for us. So,
yes, I
because
would.
I hope I'll never get to use my CPR training. It's just there in case, but I suspect that a little mental health first aid I could use almost every day.
Absolutely. We can
Including
definitely
if it's
contact.
self-administered.
Yeah. Yeah, you could do it on yourself too. It's very empathy based. So yes, I would say contact Michael and then he can help arrange something with Courtney and Tony. We would love to do that.
That's up to Madam Chair.
Okay, we're Madam Chair.
Yeah, I think that would be a great idea. Any other questions or comments? Oh, yes, Mr. Roth.
Thank you. Roth here. Kim, could you bring up the map where you were showing that the response? It was, Aurora, Elgin,
yeah.
St. Charles. I have a question. That's my first question. I don't consider St. Charles the third largest city in the county. But one part of the question is we had a graph across the whole county where we're getting responses, because that kind of tells you where we need to reach out. In some cases, like out west, there's not a large population. But the other, does it vary on what they're requesting help in, depending on the city?
It does, Bill, and I should have anticipated you asking this because you're a data person.
Yeah.
When this is all when we have more data, and I have a little more time, we will dive deeper into kind of those cross analyses. I would love to do like a heat map looking at which areas have the top, the percentages based on population, as well as the needs in each area. And we kind of do that with Iris. So I would love to also compare this to Iris. Liz is over there probably like, oh, okay, I guess our group will be helping us with it. They're amazing at putting this in visualization. So we'll definitely do a whole breakdown in a report when all's said and done.
And then a second question was, you're trying to get this advertised more. Are you working with the Regional Office of Education?
Oh, yes, we definitely work with them all the time. We're planning our Youth Voices Forum for next year right now with them. And we give them, we've done a demo for Behavioral Health 360 and they're connected with our information.
Because last spring they had an all-day event out at the Q Center offering different classes. And I think that would be great if you guys could.
Oh, yes, we present every year and I am scheduled to present this next year, probably with some of my colleagues as well.
Okay. And then, I don't want to take too long, but can I get copies of all this? My church has suicide prevention.
Oh, great.
And I think last time you came out with this, I gave out over 100 of these. So I need a few more.
Yes, if you need the AOK resource guides or the Behavioral Health 360 pamphlets, those again are even good to keep on. Like my doctor puts them outside. He's primary care and puts them like.
And that's what our church has actually done. We have a counter where we put all this stuff out. So I'll talk to you offline.
Yes, and there are faith-based resources in Behavioral Health 360 as well. If that's your thing, there's a lot of those kind of podcasts and videos and different things like that.
Okay, thank you very much.
Yes, Ms. Bates.
Me again. This may be quite off topic, but who knows? Speaking of the stress that people are undergoing because of the immigration issues, there's a card that with the ICIRR hotline number on there. Do you have a supply of those cards?
We did. Do we still have them? Yes.
Where could I get them?
Yeah, we can get some to you.
Thank you.
Ms. Chuby.
I don't think my question's for Kim, so I'm sorry.
That's okay.
I'm just would like to respond to a couple things that were said and then something that Michael had mentioned earlier. But I mean, if that's okay to ask now.
Yes, go ahead.
Okay, first of all, I don't personally believe that the health department should be anything other than apolitical. So you're not in the job of doing civics or anything like that. My second question has to do with the negative, you talked about the negative psychological issues, and so did Kim, about what's happening with these large scale immigration things. Is I have to take this hat off and put on the old hat. Is this now going to be a recognized ACE? That, because I think that this is probably, I know you said
I
it
don't
was
know that word.
adverse childhood experience.
Thank you.
There's a bunch of recognized ones that if you fall into this, then you're more likely to have that happen. And I know that this isn't, I know you said it's kind of similar to a death of a parent, but it really isn't. And it's kind of similar to being in prison, but it really isn't. It's kind of like you take all of the bad ACEs and you put them together, and here we have this mega ACE. And so I just want to know if you think there's a movement to actually recognize this as an ACE, because then we can do trauma-based, data-based, outreach for that. And I think it's probably not a health department question, but maybe it is.
Well, I would consider myself a semi-expert in ACEs, and I would say it falls under structural racism because, as Michael said, a lot of folks are being targeted for the accents they have, the color of their skin, before it's known whether or not their status, right? So I think that stress and pressure, especially what we heard from the Youth Voices Forum about the kids, all of whom are probably legal citizens at school, getting threatened about ICE, and kind of that general feeling every day with the systems kind of working against you. So I would say, because that's part of the ACEs, they've added that community level, which is structural racism, which is an ongoing chronic stress that kids are experiencing from birth. And it changes the way their brain works. And as far as like this being an ACE, probably also falls into similar, the pandemic. It's something that we all as a society are experiencing at the same time. Just like a natural disaster or something else, that kind of sets you back and then you have to recalibrate.
I'm just not sure that you can recalibrate from this. That's why I wondered if it could actually move out of the structural racism and go into something that, because this adverse childhood experience affects someone who didn't have it as a childhood experience. And I understand that so does structural racism, but I think this is a little more, like you said, like COVID, it affects everyone. And even if you think it doesn't affect you, it's affecting you. It's either making you angry because you think it's unfair, or it's reinforcing something that you believe to be true. So either way, it's still this major thing that, I don't know, I'm just obviously not an expert on ACEs, but I just think because it's moving through more than I think one thing and affecting more people, I just think it needs to be seriously considered, because I don't know that we can get over this. I mean, it took us a long time to get over the Japanese internment, and I can guarantee there's probably a whole bunch of people who will never get over that. So I just think I just think we just need to rewire how we think about these things.
I hear you. And I encourage you to look up the 7 generations theory in epigenetics, because that will dive deep into that subject.
I have a question.
7 generations. Just like.
I have a question, and that is, I think it would be wonderful if everybody on the committee and then everybody on the board could help promote this. Could you help us with the best way to promote that? Give us some parameters of what you think we should put like on our social media or out on our, how we communicate to our constituents. I think there's so much information here that I would like to have some help making it more concise to get the information out so that they can then delve into it the way that they need to. So can you help us do that?
Yeah.
That would be great. That would be great. Okay, any other questions? Thank you for that excellent presentation.
Yes, a very good presentation, Kim.
Did we talk about having that presentation sent to all the board members? Could we have it?
I'll send it around.
Thank
Yeah,
you.
not just to the committee members. I think that's a really, really good idea. Thank you. Thank you. Okay. Anything else from you, Mr. Isaacson?
Not until new business.
Pardon me?
Not until new business.
Okay. Any old business? Okay, and then I would like to have a unanimous consent to place the reports on file.
Genesis moves to unanimously consent, putting the reports on file.
Okay, any objections? Okay, I don't think we need an executive session. And so now on to new business. Would you care to?
Sure. So we had a great discussion over the last couple of months, I think, where we talked about committee goals. I think one eye-opening thing to me was that these were goals for the committee and not health department goals that we're restating. So again, thank you to Ms. Juby. She took our existing goals and just sent an email.
I just want to interrupt. I gave everybody a copy of that this morning, so you can see where it was and how much improved her recommendations were. So a big thank you to Ms. Juby for doing this. And go ahead.
Yeah, no, and it's on the screen as well. So the you got it.
Okay.
Orange, whatever color that is what we currently have. And then the white is changing it to be more appropriate potentially for the board. So these are just the initial draft comments that Leslie had forwarded. So turn it back to you for discussion.
Yeah, I think that these are excellent. And I think that you brought up the excellent point that we were talking about the health department goals. And I think that the committee goals is what we should be focused on. That's where our purview is. So do we have any comments or questions about the new goals? Other than I think they're great. Thank you, Leslie, for doing that.
I just wanted to thank Leslie for this too. I think they're great. Thank you.
You're welcome.
And so if you notice on today's agenda, we did post them at the top of the agenda for our goals. And that's where they will be from now on. These new goals will be at the top of the committee. They're not?
Those are 2025 still, yeah.
Stand corrected.
So
I
you're all
sit
good.
corrected.
You're
They
all
will be
good.
on there next month.
Will be.
They will be next month. So thank you again, Leslie. They
Welcome.
were great.
It helps being a policy person. You could,
And-
amazing.
Included in the email was the joke about the school year too. So
Hey, it's because we made a joke about the school year at the last meeting. It wasn't that I had the wrong hat. Never mind.
we just know what hat you used to wear. That's all. Okay. So, and then the other new business is we are talking about next month having our committee meeting up at the new facility in Elgin. And we'll have some refreshments of some sort and tours. And we hope that you all can make it. Please have a quorum. We won't have a meeting except for, you know,
The functioning
World Toilet
business.
Day and that sort of thing, like I always do. But yes, Mr. Roth.
Would that be considered then the ribbon cutting? Or was that
Oh,
be a
this is
separate
gonna
one?
be a soft opening, so I don't know.
Okay,
yet.
and that's why I'm asking.
Yeah, it's not completely planned yet.
Okay,
Including, I'm thinking we might be able to make it a little bit later than 9 o'clock in order to give people travel time, but we'll let you all know. And I do know that
Boone
the
is-
legislative meeting after
There's-
that has been canceled for December. So we have time to stay up there and do the tours. But it would be lovely to see the facility as it is now and then to see it later when it's all pretty.
so you were
So-
saying soft opening, so the scissors will be the safety scissors
It's going to be tape and place.
and the safety scissors
Yeah,
that we used to.
exactly. That's
didn't we?
exactly right. So,
Madam Chair. Madam
So-
Chairman,
okay, so
Madam Chair, just want to confirm, so look at December 17.
December 17th, yes, yes. And we will make sure you all get the information, but that's where we're going to be. So any other questions?
I'll be there.
Yep, Madam Chair.
Mr. Gripe. Yes, just one moment. Mr. Gripe is first.
Oh, that,
Okay.
well, thank you. Just a thank you to Michael, for putting Corbella Clinic on the website. In other community organizations, hear about how they're helping women get education. They're not making them make a decision, but and I'm hearing stories about people who had no clue what their options were. Seems obvious, but anyway, so thanks for putting that out there. It's really, and people mentioned, I was in a Kiwanis meeting and people mentioned the Kane County Health website that had that on there, and that's how they got connected. So thank you.
And Mr. Young, you had something you wanted to add?
I do. I have something that's totally different. And it's, at first when I heard this term, I thought it was funny, and it still kind of is funny, but it actually is serious and it is affecting some people. And it's called Trump derangement syndrome. And it was like a month ago or so that these two pregnant women decided to take a whole bunch of aspirin, and I think one of them went into serious health problems just because Trump said that aspirin was known to give autism or something like that. So, I mean, when you have this kind of thing happening, I don't know. It's a mental condition for sure, because you get triggered by Donald Trump, and that is happening. So I just wanted to bring that out to everybody. Whether you want to talk about it or not, that's fine. And then it's, at first I thought it was funny, but when women do stuff like that, that's a serious problem. Thank you.
Thank you for your remarks. I think that mental health is an issue that we all experience, male and female. And I think your statistics today, Ms. Peterson, showed us that it has become more equalized as to who seeks help, men and women both, which I think is great progress. So mental health, no matter what the cause, affects us all. So we all need to be aware.
And Madam Chair, if I can just mention, it's critically important, especially now with the ease that we can get incorrect information online because we all have a phone in our pocket. I think making sure that people, and this is a big part of what we do at the health department, it's a core tenet of public health to get accurate information to people. So we look at the population and we encourage people to work closely with their healthcare provider. And I know with healthcare providers that I work with and talk to, even they're struggling now because we all are like, well, I looked this up and now I know more about this than you do. So make sure that you're getting your information from a valid source.
Always check.
And it's easier said than done. And people profit in different ways from different types of information. It doesn't have to be money, people gain from different types of information. So it is something I think kind of going along with what Mr. Gripe said earlier. Hopefully we're getting better at educating young people about how to discern. And this is not even talking about AI and the ways that we can more easily be tricked with fake videos and things like that. So we are very lucky. It's the year 2025. We live in one of the most advanced countries in the world. We have amazing medicine. We have greatly benefited from tremendous research that's been done over the decades. So that's really important that we use that information when we're making our decisions or we're making our policies. So I think that the comments, like Mr. Young said about the Tylenol incident, the Tylenol comments did not match with the research. And so I think it's important for people to see that there is not a link with Tylenol and autism. That's been very well researched. So we just have to be careful.
Okay. I think we're ready for chairman's comments, right? First of all, I don't know if you all noticed, this is a thank you note I received from the artist. And this is more of her own artwork, which I think is adorable. I just wanted to share that with everybody. And then also, just in case you didn't know, today is GIS Day downstairs. It started at 10, it goes until 2 if you want to stop on your way out and see what's going on in our GIS world downstairs. So I just want to say thank you again, everybody. I think this is a tremendous group and a lot of good information. And I look forward to having you help us get more of this information out where it needs to go. And stay tuned for the soft opening next month. So I would like a motion and a second
Yeah,
for,
5 o'clock, but yeah,
what was that?
up at 5 a.m., but okay.
I'd like a motion and a second to adjourn.
Genesis moved.
Second.
All in favor? Favor? Thank you, thank you, thank you.